All right, let's take a look at this. I think what we're going to do now is I'm going to make some videos just showing us the actual human cadaver anatomy, just because I do not know if I'll get a chance at all to be able to get some of the models here for lab practical, and for you guys to have a chance to see what the actual material would be like for the lab practical, which I assume is going to be on, like the actual cadaver and pictures and be online. So let's take a look at the head and neck area. All right, as we go one layer down, you can see the frontalis muscle and the gallia epineuritica as well over here. And you can see the orbicularis oculi surrounding the eye. You can see the levator palpebrae muscle right here, forming most of the actual eyelid itself. And we're going to see that you also have some subcutaneous tissue, some fat, some skin, some lacrimal glands as well on that. So it's not just the levator palpebrae muscle. Now, as we go a little bit lower here, you'll also notice that you have a couple other muscles that we've talked about. Number one, right next to your nose, we're going to see that there's your levator labii superioris, and then zygomaticus minor, zygomaticus major. Then you have the orbicularis oris around the mouth, and you have the masseter going in the back. One thing you do also notice here is that you do see the actual platysma muscle, which we don't see on any of our other models down at campus because it's so superficial. As we go the next layer down, you can see the sternocleidomastoid right here. You can see the sternohyoid, and you can see the larynx over here as well. As you go further down even more, you can now see some of that sternohyoid muscle, right? You can see the remnants of the thyroid gland right here. And actually, I was wrong before. This is the one cadaver that we see that they've had one half of their thyroid gland removed. It's kind of cool. You see, it's only half the thyroid gland on the left side. You see the isthmus of the thyroid gland, but it's missing it on the left side right here. His left side, our right side. So it's kind of cool seeing that. You see the scalenes, anterior, middle, and these are actually the brachial plexus. So we can see the scalenes a little better on the lateral view, which I'll show you in a second. So on this view, that's about it. We don't really see anything beyond that. So let's take a look on the lateral view. On the lateral view, you can see the temporalis muscle. Again, zygomaticus major. You can see the rhizorius. You can see the masseter. You can see the sternocleidomastoid and the platysma that actually is superficial to it. As we go one layer deeper, now you can see the actual insertion of the temporalis muscle way up here. Remember, insertion is where the actual muscle binds with the bone tissue itself, where movement occurs. Over here, deep to the zygomaticus major, the minor, to the rhizorius, deep to the masseter, forming your cheeks. These are your Buccinator muscles over here. Now, one thing else we can see as we remove the platysma is a really good sternocleidomastoid, and you can see this muscle that goes down and then around. The omohyoid has an anterior and then a lateral belly right here. As we go a little bit deeper, and even the back, you can see the trapezius and the splenius capitis and the occipitalis. As we go deeper yet, now we can see the scalenes a little bit better, right? So you can see the anterior medial scalenes right here. You can't really see the posterior well, it's deep in here. And you can see this one right here, right? This going backwards, so we know it's not the scalenes. This is your splenius capitis. Let me phrase that. This is your levator scapulae. This is your splenius capitis. As we go a little bit lower yet and deeper yet, now we're going to see some of these muscles that go into the tongue, and it goes into your actual hyoid bone right here. Here's your stylohyoid. Here is your styloglossus. This is your mylohyoid, forming the floor of our oral cavity. So omohyoid is a little bit lower. Let me see if I can get that a little bit better right there, where the actual pointer is at. Here's an omohyoid, and here's a genioglossus right here. Remember, genioglossus fan shape, it should go to the actual tongue right here, and it does. Again, good one here to see is it says styloglossus, stylohyoid. Now we don't see the posterior digaster or anything on this picture. All right, too deep. Let's take a look at a mid-sagittal view. On a mid-sagittal view, yeah, it's not a really great view right here. And again, please do not show this when you have kids around. They will freak out, so yeah. So let's take a look again one more time on a posterior view then. On a posterior view of the head and neck, we see the occipitalis right here. We see the trapezius muscle over here. As we go a little bit deeper yet, we should be able to see the Spineless Capitis muscle. And here's your levator scapulae right here. And we go a little bit deeper yet, then you can see these muscles that make up our erector muscles of our neck. These are your semispinalis capitis, which is not on your word list. So when you take a look at that, important thing to note is just right here, Spineless capitis, levator scapulae, and again right here, this is the start of our rhomboids major and minor. So let's take a look at our thorax right here. And on the thorax region, we're going to see here on top, hopefully we can move it up a little bit now. We can see on top right here, right, your sternocleidomastoids. You can see our pectoralis major. You can see a little bit of our trapezius muscle coming out. And again, down here, since this is very superficial, this is your external obliques on each side and your rectus sheath right down the middle. As we go a little bit deeper yet, we should see the pec minor right here. The pec minor comes from the ribs, goes to your coracoid process, and keep in mind that this is not for movement, unlike the pec major, which is for adduction. This pec minor is for respiration. Then you see the internal intercostals, and you see the rectus abdominis now, a little bit lower. As we go even deeper yet, you can really see the internal intercostals and the external intercostals are out there. So let's take a look at the abdomen. Let me see if we can have a better view. Nope, that's the only view of the thorax, which kind of makes sense. The abdomen, we should be able to see. Again, what we're going to notice is there's a male. So here's, in terms of the male right here, you see the external oblique, rectus sheath. As we remove the next layer, you see the internal oblique right here. And now we start seeing the actual six-pack muscles, your rectus abdominis muscles, a little bit deeper, right? And unlike the chest where you have the rib cage and the sternum, there are no bones that help protect and form structure of the abdomen. So all we have are really thick muscles and this real thick, really tough, dense connective tissue called the linea alba. And it acts like a pseudo sternum. So then muscles can attach to it. As we go deeper yet, then you see the transverse abdominis right here. Now, because it's a male, we will also see this part of it right here. Right? So part of the internal and external obliques, there's a little bit of a hole here for the spermatic cord to actually exit. The spermatic cord exiting here then will allow the vas deferens to pass through, some of the arteries and veins to pass through inside of it. So very important structures here. Now, because there's a hole in your internal and external obliques, there's also a chance of getting more and being born even with a little bit of a congenital hernia occurring here. And many kids, and it's not uncommon for kids to be born with an inguinal hernia because of weakness and incomplete closure of this. So that does happen. If we look at the back area, we should see on this picture trapezius, latissimus dorsi on each side. And if it's just a latissimus dorsi and we don't remove anything, that's all we are able to see. So in order to see everything else, we got to remove those superficial muscles. As we remove the superficial muscles, then we see two other muscles here. The Spineless capitis on top and the levator scapulae. We can see that it goes to the medial margin of our scapula right here. Spineless capitis, levator scapula on this side. Then you see the rhomboids minor and the rhomboids major right here. So these rhomboids minor and major, they help in kind of retraction of the scapula. So then you can move your scapula or your shoulder blade towards the middle. As we go a bit lower, you see your posterior serratus muscles right here. And in this view, I'm going to get started in a second, and we'll talk in a second about the muscles of our rotator cuff. Just 1 second. Right? Again, now we can see rhomboids minor a little bit better. Before it was rhomboids major. And if we go a little bit deeper, then you can see the iliocostalis as it goes from the iliacus all the way up into the ribs. You can see the longissimus going straight up right here. Here's the longissimus going straight up like this. And then the ones that look just like thick fibers. It doesn't even look like muscles. These are the ones real close to the spinous process. So when we're looking at this, I want you to think, here's the spinous process, an imaginary line of bone tissue coming right down the middle of this person's back and our back as well. The spinous process then is going to divide the back into left and right sides. This one immediately lateral to that spinous process, this really dense fibrous muscle, that's our spinalis muscle. Then longissimus, then iliocostalis. Remember the actual mnemonic for it. I love spaghetti. So I for iliocostalis, love for longissimus, spaghetti for spinalis because it's next to the right next to the spinal column right there.